How's it going, guys? We have a difficult question for surgery for 2CK. This could have easily been a long, rambling, 12-line fucking paragraph like 2CK will normally have their NBME questions, but I'm just cutting to the chase. All right, so before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. Really appreciate it. Find me on Instagram, Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the question. 54-year-old woman with long-standing rheumatoid arthritis is scheduled to undergo a left total knee replacement. Current medications are acetaminophen, naproxen, prednisone, methotrexate. Blood pressure 140/90. Cardiopulmonary examination shows no abnormalities. Creatinine is 1.2 milligrams per deciliter, which of the following studies is most appropriate prior to surgery. So we just simply have a patient with RA, and then what do we do prior to surgery? Let's just walk through the answer choices here. Choice A, ACTH stimulation test, wrong fucking answer. This is for adrenal insufficiency. So if we inject a patient with ACTH, we expect cortisol to go up. But if a patient has e.g. Addison disease, Waterhouse-Friderichsen syndrome, and we give exogenous ACTH, cortisol will not go up, okay, appreciably. Wrong fucking answer. Choice B, antibody assay for cyclic citrulline peptide, wrong answer. You should just be mindful that although rheumatoid factor is the antibody most frequently seen in rheumatoid arthritis, that anti-CCP, cyclic citrulline peptide, is actually the most specific antibody. Okay, it's seen in fewer patients, but if the patient has it, absolutely ruled in for having RA. Choice C, dexamethasone suppression test, wrong answer. This is to diagnose an endogenous etiology for Cushing syndrome, okay? Long fucking discussion here, okay? But you should just know that exogenous steroids are the most common cause of Cushing. We don't need dexamethasone suppression test for that, clearly. This is for endogenous causes. I'm not going to spend 40 minutes on a tangent about that right now. Choice D, flexion extension x-rays of cervical spine is the correct answer, okay? So you need to know that patients with RA are prone to get atlantoaxial subluxation, and the NBME is either going to ask directly for flexion and extension x-rays of the cervical spine, okay, this exact answer here, or CT of cervical spine. Either answer I have seen on the NBME material for 2CK. It's factoidy, right? I mean, I see students hovering over the question trying to figure out, there's nothing to figure out. It's just patients with RA can get atlantoaxial subluxation, and prior to intubation, okay, they are going to need flexion extension x-rays of the cervical spine or a CT of the cervical spine. I have seen another question where a patient had RA and had sensory abnormalities of the upper limbs, okay, it was like paresthesias of the upper limbs, and the answer was MRI of cervical spine, and it had nothing to do with surgery. It wasn't a surgery question, but I was like, okay, that's interesting. They're giving you a patient with RA who already has atlantoaxial subluxation impinging on the cervical spine, okay? So it's factoidy, sounds low yield, but I've seen it enough on NBME questions, so it's worth mentioning. Now, as for spirometry, it's the wrong fucking answer, but they've had this as an alternate answer on the NBME, okay? So they will write pulmonary function tests, and students will sometimes select that. I mean, it sounds reasonable, right? I mean, why not be aware of patients' pulmonary function prior to surgery, but it's not what they want, okay? It's just not. I mean, if they're going to give you COPD, severe asthma, I mean, those are things to consider, fine. But you just need to know that for RA, as I just fucking said, atlantoaxial subluxation, flexion extension x-rays of cervical spine, CT of cervical spine, or even MRI of cervical spine if patients are already symptomatic. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.